Nonce 432 Assignment 3. Using theory to implement change. The healthcare environment is fast changing as numerous health initiatives are implemented. Leaders must have the ability to identify relevant areas for improvement and ensure the change is inclusive, collaborative, and grounded in evidence. It is essential for members of a multidisciplinary team to feel they have a voice in the change process, as this increases ownership and commitment to the new practice. This assignment proposes expanding patient-centered care to include family-centered care in a long-term care setting. It provides a rationale for change, strategy to facilitate engagement and inclusion, and strategy to create the identified change. It also describes how Lewin three-stage model of change and transformational leadership style can be applied to the change process. Change issue and rationale. The proposed change is increased family involvement in care. The current model of patient care at my workplace is patient-centered care, which focuses on the needs, preference, and goals of individual receiving care. Why this model promotes autonomy and respect for the resident, it often limits the participation of family members. For example, care conferences scheduled during the day makes it difficult for families to attend. A shift towards a family-centered approach will allow families to play a more active and consistent role in care discussions, planning, and ongoing decision making. PCC primarily focuses on the patient alone, whereas FCC broadens the lens of including family input and collaboration. Research indicates that the quality of care improves when healthcare professionals actively involve family members in the care planning and decision making. FCC is especially important in the care of older adults because they often have complex chronic conditions that require ongoing support and coordination across multiple providers and family members. Engaging families as active partners in care contributes to achieving positive clinical outcome for the residents. Inclusion, diversity, and cultural sensitivity. It is essential to consider inclusion, diversity, and cultural sensitivity during implementation of a change initiative. When diversity and cultural awareness are embedded in the change process, the initiative is more likely to gain trust and enhance collaboration. A collaborative approach must value input from all members of the multidisciplinary team, including nurses, social workers, physicians, mental health professionals, dietitians, and family members. Each members bring unique perspective and expertise. Second, there is a need for cultural sensitivities for staff. Training staff on cultural sensitivities enables them to communicate effectively across culture and respond appropriately to diverse family expectations and beliefs regarding health, aging, and caregiving. Third, the change process should include members with different level of experience, cultural, and religious background. This encourages creativity and diversity of idea, ensuring the initiative reflects a broad range of insights. Strategies to facilitate engagement and inclusion. One key strategy to facilitate engagement and inclusion is forming a patient and family advisory council, PFAC, which includes family members and representatives. The PFAC provides a formal platform for families to contribute to care planning, policy development, and decision making. A PFAC actively and directly promotes family involvement and helps cultivate a hospital culture that values family-centered care. Second, regular feedback sessions are important as they provide opportunities for open dialogue and continuous improvements. These sessions allow staff and family to share experiences, identify barriers, and propose solutions. It is important to provide the options for anonymous feedback, which encourages honest input from individuals who may be hesitant to speak publicly. Next, making educational resources accessible, strengthen participation and understanding. translating materials into multiple languages and presenting information in clear, plain language ensure that all stakeholders can carefully engage with the change process. Together, this strategy promotes collaboration and share ownership. Strategy to create the identified change. The expansion of patient-centered care to include family-centered care requires a structured step-by-step approach to ensure successful implementation. Step 1 is to create a dedicated team responsible for planning, guiding, and evaluating the change. This team should include representatives from nursing, medicine, social work, therapy, and family members to ensure a broad range of prospective and experts are incorporated from the beginning. Step 2 involves defining what family-centered care will include and developing a corresponding protocol. This protocol should outline the specific ways family will participate in care, any required policy change, and clear procedure for obtaining consent. It should also specify privacy limits to protect residents' confidentiality and establish the role and responsibility of both staff and family members. This framework sets recommendations and guidelines for family involvement. The next step is to train staff and pilot the change. Staff training should be delivered in an interactive care-based format. This enables staff to participate, effective communication skills, address challenge scenarios, and build confidence in engaging with families. Pilot family inclusive bedside rounds with specific units is essential in testing the process on a small scale. Finally, monitor outcomes to assess success. Metrics may include patient and family satisfaction, frequency of family participation, staff engagement, and overall care outcomes. These metrics will inform continuous improvement and support scaling and initiative across additional units. It is also necessary to collect feedbacks from family and staff to refine the approach. Change theory model. The theory I will use to guide the change process is Louis three-stage model of change, the unfreezing change to refreezing model. Louis model provides a practical framework for guiding the transition to family-centered care. Unfreezing is the stage 1, which involves helping individual to let go of old patterns, old behaviors while addressing resistance. In long-term care, this starts with explaining the need for change and highlighting the shortcoming of limited family involvement. When families are not engaged, important information about routines, cultural preferences, and health history can be missed. To reduce restraint forces such as staff concerns about workload or privacy, leaders can offer reassurance, clarify expectations, and involve staff members early in the planning process. Driving forces can be strengthened by presenting evidence that FCC improves communication and enhances outcome for older adults. The second stage, moving, focuses on implementing new behavior and practices. This includes training staff on FCC principles, introducing a family involvement protocol, and piloting family-inclusive bedside rounds. Clear communication and supportive leadership helps reduce uncertainty during this stage. The final stage is refreezing. It ensures the new practice become part of everyday care. Embedding FCC into policies helps create a new norm where family involvement is valued and supported. Leadership theory. The leadership theory I found most applicable to the change initiative is the transformational leadership theory. This approach supports organizational change because it focuses on inspiring people towards a shared vision. Transformational leaders foster innovation, encourage new ways of thinking, and create an environment where staff feel motivated to participate in change. I select transformational leadership because it aligns closely with my values of collaboration, creativity, and empowerment. This approach creates a climate where staff feel encouraged, contribute ideas, learn from one another, and take initiative. It also aligns with my goals of promoting diversity of thought and fostering engagement across teams. Transformational leadership unites people around a shared purpose and help them see how their contributions support meaningful change. This makes the leadership style well suited for a family-centered innovation and teamwork, Open communication and mutual respect are essential for creating lasting change. My conclusion is this: family involvement is crucial to enhancing patient care, particularly in settings where support and shared decision making lead to improved outcomes. Creating this change required attention to diversity, inclusion, and cultural differences so family feel respected and staff can respond to various needs. I will use Lewin's model to understand the change process because it offers structure for guiding the transition, while transitional leadership provides the inspiration and empowerment needed to sustain it. Together, this element creates a foundation for lasting, meaningful empowerment in care. Thank you.